Hello, my name is Jim Ham, and I'd like to share a video today on the mathematics of COVID-19. In this video, we will cover different rates, population death rates, case fatality rates, and infection fatality rates or ratios. There's some mathematics in here about herd immunity. Why is it that they recommend to avoid big groups? We'll look at the mathematics behind that. And finally, when we're doing COVID tests, when are they useful? When are they not useful? Should everybody get a test? Or should we restrict testing to certain subpopulations? First, rates. We'll look at the three different kinds of rates: case fatality rate, population death rate, and infection fatality rate, and the differences between them. You may have noticed that on some news broadcasts, they have a running total of the total cases and deaths, both in the world and the United States. Cases are determined by testing. Cases establish the minimum number of coronavirus infections, since many who are infected are not tested. So let's use those two numbers and do the calculation for the case fatality rate. We just take the total number of deaths and divide by the total number of cases. You can see globally, the case fatality rate is 3.8%, and the case fatality rate in the United States is 3.3%. So you can see that the United States case fatality rate is a little bit less than the case fatality rate in the world. And of course, each one of those 702,000 are individual lives and families that have been devastated by the death of a loved one. Our condolences to all of those who have been victims of this disastrous disease. Now, the case fatality rate has limitations. First of all, there are many unreported cases. As you may have heard, between 40 and 50% of all of the cases are asymptomatic. That means individuals have the virus but are not experiencing any of the symptoms like frequent headaches and fevers and feeling tired all the time. And because those individuals are asymptomatic, they probably will not go down and get a test. And so they are one of the unreported cases. The other limitation is that some of the individuals, a small percentage of the individuals who are tested and are found to be positive, will actually die. So when we do this ratio, the death number might be a little bit underestimated because some of the individuals among the cases may yet die. And since the number of tests administered in different countries, in different cities and states and counties and so on, they vary from region to region. The case fatality rate is not the best rate to use to compare regions. Instead, we'll look at the population death rate. Now, the population death rate is the total COVID deaths in the population divided by the total number of individuals in the population. So in order to calculate this rate, we need to know the population of the region. So you can see the calculations here for the world's death rate, 0.0092%, and the United States death rate, 0.00048. The way that you would interpret the United States death rate is that 0.048% of the US population has died from COVID-19. Of course, as time goes on, as the number of deaths increase and the population stays relatively fixed, you will see that death rate increase. We can calculate the population death rate of any region, the world, the United States, an individual state like Michigan, or a county. The rates that we use are not percentages usually, because the death rate expressed as a percentage is a tiny number. So instead, we usually, as you see in this table, go over to the death rate per 100,000 or the death rate per million and use those rates. It's easier for us to compare the two countries using bigger numbers than it is for the tiny fractions. For example, in this situation, we see the US death rate per 100,000 is 48, and the death rate per 100,000 for the world is 9.2. Now, if we divided those two rates, you'd get a number close to 5.22. So then we could say that the US COVID death rate is over 5 times greater than the overall world's death rate. Looking at the top 20 highest COVID-19 death rate countries, United Kingdom is at the top, followed by Peru and Chile. The United States has the fourth worst COVID-19 death rate at 48 deaths per 100,000. We can compare countries by dividing their death rates. Colombia is also indicated there. If you divide the United States death rate by the Colombia death rate, you get about 2. So we can say that the US death rate is over 2 times greater than Colombia's COVID-19 death rate. Here's a listing of all the states in the United States. The state with the lowest death rate is Hawaii at 1.9 deaths per 100,000 in the population. And the largest state death rate in the United States is New Jersey at 178.8 deaths per 100,000. In the tables, you can see the states that have the highest COVID death rates and the states that have the lowest COVID death rates. You can compare the death rates. If you divide 64.8 divided by 7.9, we could say that Michigan's death rate is over 8 times more than Oregon's death rate. Now, testing. Why is testing for the coronavirus important? Well, it identifies the most recent number of cases or infections. And since we know that a small percentage of those cases will require hospital stays, might need special medicines or ICU beds, or even ventilators, the more current cases that we have, the more hospital resources that are going to be needed 2 to 3 weeks from now. Extensive testing will help health professionals plan so that sick patients receive the best possible care. Testing leads to quick identification of cases, and if we can identify cases quickly, we can get those individuals the treatment that they need. Also, if we catch the case early, they can do contact tracing and try to identify all those others that came in contact with the infected individuals so that they too can get quick and effective treatment early on. Testing is also important because the information that they get from testing help them plan mitigation efforts, help investigators characterize the prevalence and the spread and the contagiousness of the disease. This table is arranged by the population in the states and also by how they're performing in controlling the COVID infection. In the left column, we have 4 of the better performing states, and in the right column, we have the worst performing states. The red graphs are the number of cases over time, and the gray graphs are the number of deaths over time. What you will notice in the better performing states column is all of those, if you look at both cases graph and the deaths graph, the number of cases and the number of deaths are decreasing, getting closer and closer to 0 as time goes on. If you go over to the worst performing states, as time goes on, you'll see that they're achieving their maximum number of cases in recent days. And so Georgia, Tennessee, Louisiana, and North Dakota all have their largest number of cases right here in early August. Now, what you'll notice about these graphs is you track the day from the peak number of cases to the peak number of deaths. There's a difference of about 2 to 3 weeks. So what this means for those worst performing states is that in about 2 to 3 weeks, Georgia, Tennessee, Louisiana, and North Dakota are going to start to experience their maximum number of deaths. So how deadly is the coronavirus? To answer that question, we could calculate the percentage of those who are infected who will eventually die from COVID-19. We call this the infection fatality rate. This is the third of the 3 rates. We really don't know what this infection fatality rate is yet. Early estimates range from 0.5% to 2.5%. One recent estimate was 0.26%, and the CDC currently estimates this infection fatality rate to be 0.65%. Now, the formulas are pretty simple. You just take the death rate and multiply it by the number of people infected, and that gives you the number of COVID deaths. Since we know the number of COVID deaths, and if we estimate the death rate, we can estimate the number of people infected. So here are 4 examples in this table of different infection fatality rates. We're going to assume that there, in early August here, are 160,000 deaths in each case. And if you take those 2 numbers and divide them, you get the number of Americans infected. And then if we assume about 328 million people in the United States, you can then calculate the percentage of Americans that are actually infected with the disease. If we go with the prediction, the 0.26%, this would mean that at this time in early August, there are 61.5 million Americans that are infected, and that makes up 18.8% of the population. Well, we only have about 5 million cases right now. And so either the death rates are too low or the number of confirmed cases to date is grossly underestimated. Or, of course, both of those two things can be true. Continuing on how deadly is the coronavirus, we can compare the seasonal flu, which is also deadly, to COVID-19. The results for the seasonal flu in a 12-month period over the last several years, the number of infections from year to year range from about 9.3 million to 45 million. The percentage of the population infected ranged from about 3% to 11%. This resulted in 12,000 to 61,000 deaths. And the death rate of those infected, the IFR, is somewhere between 0.1% and 0.18%. Now, if you compare that to COVID-19 in 5 months, the number of infections, based on the testing, 5 million, of course, that will increase. The percentage of the population infected, we don't know what that is. Maybe it's higher than 11%. And one of the estimates we just did, it was close to 19%. The number of deaths, we have 160,000 and counting. And the death rate of those infected, it's probably higher than 0.18%. Our lowest estimate that we have to date is 0.26%. And of course, once more information comes in, these numbers may vary. Okay, we're going to switch now to herd immunity. Herd immunity occurs when enough people in the population are immune to the virus, making its spread unlikely. As a result, if we have herd immunity, the entire community is protected, even though many of the individuals in the community are not themselves immune. Herd immunity usually occurs when a vaccination is developed. A large percentage of the population gets the vaccine. That leads to a high percentage of the population that is immune, and hence we have herd immunity. So the question is, since we don't have a vaccine at this point, in the absence of a vaccine, should we strive for herd immunity in the United States? Here's a calculation of what that would mean to have herd immunity in the United States without a vaccine. We start with 328 million individuals. We identify the herd immunity threshold. Depending upon the expert you consult, this might range from 20% up to 80%. I selected 70% in this example, and some experts will say that for this particular virus, 60 to 70% would give us herd immunity. So I selected 70%. Now, if you take 70% of the population infected and you multiply that by 328 million, that means 230 million Americans will need to have the disease in order for us to achieve herd immunity. All right, so if we assume that that many people have the disease, then what's the fatality rate? Well, if we assume the 0.26%, which was the percent that we referred to in the previous slide, I chose the number 0.3%, then that means 689,000 Americans would die from COVID. And that represents more than 500,000. And in order to achieve herd immunity, we would have to have about 500,000 more deaths, since we're only sitting at about 160,000 now. So the answer to the question, should we strive for herd immunity? The answer is absolutely no, because in order to do so, we would need an additional 500,000 more Americans would need to die for that to occur. So what we're hoping is that a vaccine will be developed, and many more individuals around the country can be vaccinated so that herd immunity can be achieved through vaccination. Why should we avoid crowds? It is recommended by the World Health Organization and the CDC that we should avoid crowds. What is the mathematics behind that? to answer this question, we're going to calculate the probability that at least one person in a crowd is infected with coronavirus. In this example, we're going to start with an assumption that the COVID infection rate is 1%. If the COVID infection rate is 1%, that means 1% of the population is infected, which means 99% of the population is not infected. So we're going to calculate then, what is the probability that at least one person is infected? So that means at least one person or two people or three people in a crowd are infected and so on. There's a formula, probability formula, and the formula is that the probability that at least one person in the crowd is infected is 1 minus the probability that no one in the crowd is infected. Now we're going to assume independence, but what's important here is to look at the trend. As the crowd size increases, what happens to the likelihood that someone in the crowd would be infected? And you can see from this table, you've got the crowd size on the far left, the formula to calculate the probability that at least one person is infected, the decimal probability, and then we're going to convert that probability to a percentage. As the crowd size increases, the probability that at least one person is infected also increases. You can see a couple of the cells that I have shaded yellow there. In a crowd size of 10, there is a 9.6% chance that at least one person is infected. If you increase this to a crowd size of 100 people, there's a 63.4% chance that at least one person in the crowd is infected. And of course, if at least one person in the crowd is infected, then that could potentially lead to other infections. Here's a larger table. If you wanted to interpret some of these probabilities, if only 5% of the population is infected, that means 95% of the population is not infected. Then if you have a 100-person crowd, there's a 99.4% chance that at least one person in the crowd is infected. If only 1% of the population is infected, meaning that 99% of the population is not infected, if you have 50 people in a crowd, there's a 39.5% chance that at least one person in the crowd is infected. And the third one, if there's a 0.1% chance of infection in the general population, that means there's a 99.9% chance that a person is not infected. But when you put 1,000 people together, there's a 63.2% chance that at least one person is infected. So generally, as the crowd size increases, it's more likely that one person in the crowd would be infected with the coronavirus. This is why many summer and fall sports teams have canceled their seasons, why many weddings have been postponed, and why many schools will close in the fall. Assembling large groups will lead to additional widespread infections, and hence deaths from COVID. Okay, so you may have heard that they only think that you should go get a test if you have symptoms. Where did this recommendation come from? Where's the mathematics behind it? In order to understand this, there are three terms that I have to define here. The first is the prevalence. This is the rate of infection in the population. For the flu, it's 3 to 11% of the population each year is infected. Now, we don't really know what that number is. We think the coronavirus is more contagious than the seasonal flu, but also we have a lot of mitigation measures going on, like wearing masks, social distancing, washing hands, and so on. The sensitivity and the specificity are related to the test itself. So for a specific COVID test, the sensitivity is a percent chance that the test will return a positive result, a correct positive result, if the person actually has the infection. For effective tests, the percentage will be in the high 90%, high 90s. Specificity is similar, but this one refers to the percent chance that the test will return a negative result if the person does not have the infection. Again, we want this rate to be very high, close to 1, close to 100%. So in the high 90s. Now, to determine if the test is effective or not, we're going to calculate the false positive rate and the false negative rate. Both of these rates should be low. So that is, if someone received a positive test result, we want to be fairly confident that the person has in fact been infected with the virus. And if someone received a negative result, we would like to be fairly confident that the person has not been infected. An effective test would lead to false positive rates and false negative rates very, very low. We're going to use a tree diagram to calculate these probabilities. You can see the formulas up at the top. The false positive rate is the number of false positives divided by the total number of positive results. So of all those positive results, what fraction of them are false positives? And for false negative rate, similarly, we're going to take the number of false negatives and divide by the total number of negative test results. Two different questions we ask in setting up this tree diagram. The first is, has the person been infected with COVID-19? Yes or no? And then the next question we ask is, what was the result of the COVID test? Did it come back positive or did it come back negative? All right, as an example, we're going to use the sensitivity and specificity of a test. The CELEX test has a 94% sensitivity and a 96% specificity. We'll assume in this example also that the prevalence is 0.01. 1% of the population has COVID-19. Where those three numbers appear on the tree diagram are as illustrated here. And this allows us to complete the rest of the tree diagram. If 1% of the population is infected with the coronavirus, then that means 99% is not infected. If the sensitivity is 0.94, that means 94% of those that have the coronavirus will test positive. Well, then 6% will test negative. And so we say that there's a probability of 0.06, or there's a 6% chance that the test will return a false negative. And if the specificity is 96%, that is, if someone does not have the disease, the test will come back 96% of the time with a negative reading. That means it'll come back 4% with a positive reading, an incorrect positive reading. And so we refer to this as a false positive. Now, if you want, you can you can use a specific population size and calculate the false positive rate and false negative rate using population sizes. So if we start off with the population of the United States, 328 million. So if we use those same percentages and we use the population size, you can see that over 3 million would be in the population, would have the disease, and over 324.7 million would not have the disease. Then if we test those 3 million up at the top, and 94% of the time the test will come back with the correct positive reading. It's over 3 million. We're going to have 196,800 negative readings, false negatives those would be, because those individuals have the virus. Similarly, down at the bottom, if 324 million do not have the coronavirus, we're still going to get close to 13 million positive readings. But most of the readings, over 311 million of them, will be correct readings of negative. Okay, let's go ahead and then use these numbers to calculate the false positive rate and the false negative rate. There are 4 possible outcomes. A person can have the disease and get the positive reading, correct decision. They could have the disease and get a negative reading, incorrect test result. They could not have the disease and test positive, which is another incorrect result. Or they could not have the virus and test negative, which is a correct result. And those are the only 4 possibilities in this example, and no individual person would fall in more than one of those categories. So when calculating the false positive, we take the total number of false positives and divide by the total number of positive test results, and we get 0.808. To calculate the false negative rate, we take the total false negatives and divide by the total number of test results, and we get 0.00063, very small. What does this mean? Strikingly, if only 1% of the population is infected, then over 80% of the positive test results are false positives. That means if someone receives their test result back and it's positive, that means that there's an 80% chance that they are in fact not infected, which is not what we would like to see from an effective test. On the other hand, if 1% of the population is infected, then there's less than a 0.1% chance that the negative test results are false negatives. This means that almost all individuals who are tested and receive the negative test result do in fact not have the virus. If the prevalence was so low, this would not be an effective test because of the large false positive rate. Okay, here's a second example. I've increased the prevalence to 40% and did the same calculation. Though instead of using the population of 328 million, I'm using the population of 1. So you can think of this as 100%. I'm going to use these rates in order to calculate the false positive rates and the false negative rates, as opposed to the population numbers. Here you see the calculations. So when the prevalence is 40%, the false positive rate is 0.06 and the false negative rate is 0.04. Those are pretty good, very low rates, and so probably with a prevalence of 40%, these tests would be effective. You may have seen in the news here recently, Ohio Governor Mike DeWine. He was asymptomatic, but he had to get tested for COVID because he was meeting the president in Ohio. When he got the test, he tested positive. But as I said, he was asymptomatic, so he got tested again, and the second test came back negative. So the first test probably was a false positive. And if he was really concerned about whether he had it or not, he could go get tested for a third time. So due to the errors in testing, even with very good tests, usually a good idea to be retested if you receive a positive test result and you are asymptomatic at the same time. Okay, so here's a graphic related to testing. And of all the individuals that get tested for COVID, actually do the test, there's a very small percentage of them that actually are tested positive. Turns out that since we've been tracking this, only about 9.4% of all of those tested received a positive test result. And if you look at just the last week of July, the chance that someone would get tested and receive a positive test result was only 7.8%. So even those that get tested for COVID, most of the time they do not have the infection. Now here's a table describing, with that same test, the Sellex test, where the sensitivity is 0.94 and the specificity is 0.96, with different prevalences. Our first example, we used a 1% prevalence. And in our second example, we used the 40% prevalence. And here are some other prevalences that you could calculate as well. So as the prevalence increases, the false positive rate decreases, but the false negative rate increases. There's always a chance for a false positive or a false negative. Now, if you look at the row for 10%, that's very close to the 9.4 testing rate. You can see that the false negative rate is a very nice rate, less than 1%, but still a high false positive rate at 27.7%. However, if we advise individuals to get tested only if they are experiencing symptoms, which is the current recommendation, then the prevalence rate is going to be close to the positive test rate, which is, as you saw on the previous slide, 9.4. And this is why they advise that only those that have symptoms of COVID, multiple symptoms of COVID, get tested, because the prevalence for those that get tested is much higher than the prevalence of those from the general population, and it would make the COVID tests a little bit more accurate. But even so, you can see that there's lots of error built in to these tests. In conclusion, and these are based on the World Health Organization and the CDC's recommendation, and in this video you saw some of the mathematics behind it. Number one, stay away from large groups of people. Even if it's unlikely that individuals from the general population will be infected, it's very likely that at least one person in a crowd would be infected for large crowd sizes. If you are unable to avoid crowds, leave at least 6 feet distance between you and others, social distance. Wear a mask when out in public or in the presence of others. Assume that you and everyone else is infected and asymptomatic. Anything you do to lessen the chance of receiving or passing along the coronavirus until a vaccine is found will reduce the chance of others dying from the disease. Stay home if you feel unwell. Get tested immediately. if COVID-19 symptoms are present and you receive advice from your healthcare provider that you should be tested. So thanks for watching. I hope you learned a little bit more about COVID-19 and a little bit about the mathematics behind some of the recommendations that are made by the CDC and the World Health Organization.